Hello nurses and future nurses, welcome back to my YouTube channel. And on today's episode of Nurse Clement B, I'm going to teach you on how to bed bath a patient. You remember, there are some helpless patients in the hospital, unconscious patients in the hospital, and they need total care. They are dependent on the nurse. So for you to be able to carry out such procedure, you have to watch this video so that you have the skills at the tip of your fingers so that you can take care of a patient or bath the patient on a bed. So this procedure is called bed bath, right? So do not forget to like, share, and subscribe to my YouTube channel. And thank you for all your support to my beautiful students. Thank you for your support. And to students, nurses around the world, nurses and midwives around the world, thank you for your support. Before carrying out any procedure, you must set your requirements, right? So my requirements are set, and it's a trolley procedure, of course. These are our requirements. You must have a large Macintosh which you use to cover the mattress to protect the bottom sheets. You must have 2 bath towel, and then bed sheets, blankets, and you can also give oral care after the bed bath. You can take care of the hair. Also have my comb, my brush, powder to take care of pressure areas. Of course, you have to lubricate the skin to avoid cracking. I have my jelly here. And soap in a soap dish. Then 2 bowls for mixing of water. And I have my jugs, one containing cold water and the other containing hot water. I have also bottom shelf. I have apron, of course, apron, glove, pillow in case I want to change the pillow. So I also have laundry bag in case the patient's clothing is soiled, in case the patient I want to change, or the top sheets or the bottom sheets I want to change them. If they are clean, of course I can reuse them, so it's optional. If the linens are clean, I reuse them, and if they are not clean, I can change them. That's why you can see some bed linens are here, right? So sit back, do not go away, watch this video till the end. It's a 2 nursing procedure, of course. I need an assistant so that she can assist me with this patient. So this patient is somehow helpless, even though the patient is conscious but is helpless, right? So I will call an assistant to help me carry out this procedure. And when I call my assistant, then the next thing is for us to wash and dry our hands, right? Perform hand hygiene, and we don't glove. So follow me and let's go and get an assistant. Performing hand hygiene, and now I'm donning my glove to protect myself. Remember, when you're carrying out this procedure, depending on the condition that you meet the patient, I can be changing my glove from time to time, right? If the glove is soiled, maybe with fecal matter or with a bodily fluid, I can change my glove. So from time to time, it's allowed for you to be changing your glove. And I've gotten my assistant already, so my assistant will assist me to carry out this procedure. So when you want to carry out this procedure, of course, I have to wheel my requirements to my patient's bedside, and the nurse that is making the bed, remember, she puts the requirement close to her so that she can have easy access to the requirements. So since this patient is conscious, of course you have to introduce yourself and identify the patient. So hello sir, my name is Nurse Clement, and then I'm here to bathe you, to clean you up. So, and I'm going to do it here on this bed. I'm going to use warm water to do that, if it's okay with you. So sometimes it's important that you tell the patient, ask the patient whether he or she likes cold water if the patient is conscious. And of course, if the patient is unconscious, you can use warm water to bathe the patient. Do not allow the water to be very hot to avoid burning your patient's skin, right? So it's important that you also have your thermometer while carrying out. If you don't have a thermometer, you can use your elbow, you can use your hand to dip in to feel the warmth of the water before you, to know the temperature of the water before you carry out. So I've introduced myself and also tell the patient that the procedure, and I'm going to use water, soap to to perform this procedure. So can I go ahead, sir? The patient says yes, and I have identified this patient. This is the right patient that I'm going to do. So the first thing now is for us to remove the top sheet. Please, can you come to the side? Always communicate to your assistant, right? So avoid covering the patient's face. Remember, this top sheet is clean, so I can reuse them. If there is any sheet the top sheet that you can reuse, kindly fold them. Avoid closing your patient's face, and put the sheets on the chair like this, back to back. You place 2 chairs at the foot end of the bed, back to back, and place the sheets there. The sheets that are dirty, we are going to place it inside this laundry bag. But for now we don't have any dirty linen, so we can use them. We can reuse this sheet since it's clean. Avoid covering your patient's face. So we keep placing it here. So the next thing now is for us to protect this patient's garment, right? And bottom, we have to protect the bottom sheets, so we are going to place long Macintosh to do that. And again, after which we're going to remove the patient's clothing. So since my bottom sheet is clean and they are clean, we will leave them there. We are not going to, had it been they are dirty, we'll remove them and place them inside. Ask my assistant to help me lift the patient to her side. And she gives me the patient towards my side also. Remember to do this swiftly to avoid stressing your patients one-sided. So the next thing now is for me to remove the patient's clothing, right? So before you do that, you have to cover the patient with a bath towel, an old blanket, or long large bath towel, so that to minimize exposure to cold and thereby providing privacy. Remember, before you do that, before you start even doing this procedure, you have to off fan, close nearby windows and doors. Make sure that the privacy of your patients is being protected, right? So to minimize exposure of this patient's body, so we have to cover the patient with blanket. So I asked my assistant to help me lift this patient so that we can remove her clothing, right? After removing the clothing, then we allow the patient to lie down and discard this. Since the cloth is dirty, we discard it inside the bin. Then you use this aspect to cover the patient's chest, and then remove the patient's trouser, pants, right? Together with your assistant, you remove and then you cover your patients. Always try to minimize exposing your patients. Since this cloth is soiled, is dirty, we just also drop it inside the laundry basket. So the next thing is for me to mix this water, right? So I'm going to mix hot and cold water. This is my hot water. If you don't have birth thermometer, just use your hand to feel the water to know whether the temperature of the water is okay for your patients, right? Now that I've mixed the water, I give my assistant towel to help me and remember I have 3 flannels, one for the face and trunk, then abdomen and with the face, trunk, back. The other one the foot, while the other one is for the perineum, right? So I pick my soap in a soap dish. Pick one of the flannels, dip it inside one of the water, apply soap. Then we start from the face of the patient. We'll start cleaning from the face of the patient, right? Ask the patient to close his or her face. Then I rinse here. Then I rinse inside the clean water, and I rinse the foam, right? And ask my assistant to dampen to clean. So I apply soap again. Apply soap again, and I clean the neck. And I ask my assistant to, and I rinse. And I rinse the soap, and I ask my assistant to dry with the bath towel. And I continue doing this, applying the soap, clean the chest, right? And under the breast. Then I rinse the soap, and I apply ask my assistant to dry the patient. Pause. I asked my assistant now to, like, we exchange. I give my, because I'm going to start with the hand proximal to distal to me, right? I can ask my assistant to do this, or I will do it myself. Ask my assistant, I give her this to clean the hand. All right, I collect and rinse it for her. I give her to remove the soap on the skin. Then I clean. And this aspect I can also do it. So now that we are done, and also we clean the axilla of the patient properly, right? So the hand proximal to me, and I also lift it up, clean it, right? Also clean it. Always start with the hand that is distal to you. Clean it and ask my assistant to dry it. I apply soap and then wash the abdomen of my patient and the chest, right? I rinse and I also clean. I ask my assistant to dry. So The next thing is for me to ask my assistant to lift this patient, to turn the patient for me. I clean the back, right? Sorry. I clean the back to the back of the neck. I rinse, right? I rinse and I remove the soap, and I ask my assistant to dry. After which I am done cleaning the back. Then the next thing is for me to remove this nail inside receiver for use, swap, and I pick the next flannel. Remember, if the water is soapy like this one, you change it, pour it inside a bucket or a big bowl like this, change the water, mix another water, right? Mix another water. So mix another water. So now that I have fresh water with me, then now that we are also done with the upper part of the body, you close this way and expose the lower aspect of the patient's body. So I pick the next flannel. I also apply soap. Always start with the limb that is distal to you, right? So I ask my assistant to help me lift the leg, right? So I clean the leg, also rinse, and I clean it again. I ask my assistant to dry. Also clean the leg that is proximal to me. Then I rinse also, and I clean it again to remove the soap. And I ask my assistant to dry. So now that I'm done with the part of the body, the next aspect is for me. I discard this second flannel inside receiver for used flannels, and I pick the last flannel. The last flannel is for the perineum. So you ask the patient whether he or she reacts to soap, and also I change my water. To the water that would be suitable for the perineum. Remember that the water should be very clean, so I dip it inside the bowl. And if the patient can do this, if the patient is not helpless, if the patient is conscious, I give the patient the flannel to clean his or herself, the perineal area. But if the patient cannot, then you assist the patient to clean his or her perineal area. So now that my flannel is ready, I clean the vulva, right? I clean the vulva. I rinse with water. Again, I clean it up, down, right? I repeat that again. till I have desired results, right? And I clean again. This last one, remember, it's only for the perineum, right? I clean again. Now that the perineal area is clean, I ask my assistant also to dry. So now that I'm done, I'm going to change this glove because it's wet already. Hair care, I dampen the hair. If the patient is having hair or cord hair that is low cord, I dampen the hair, and then start. I either use this comb or this depending on the length of the hair, and I brush the patient's hair, right? I brush it, the patient's hair, right? And I lift the patient's head a bit. Since I'm using this, so I discard the comb, or I use this big comb and I comb the patient's hair. That I've given hair care to this patient. So now that I'm done with this, before I apply cream to this patient, that is Vaseline, to lubricate the skin, to avoid the skin to cracking, we have to perform oral care. If the patient needs oral care, then I'll give the patient oral. Remember, this patient is just helpless, not unconscious. So I apply toothpaste to this, and I give the patient to perform oral care, right? So after which I make the patient to sit up. I make the patient to sit up this way, right? Then I also apply dressing towel on those patients, and I ask my assistant to hold the bowl for me and ask the patient to turn towards me. Pick my water and give the patient to like brush his or her teeth, blah 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 blah. After which I allow the patient to drink water, rinse his or her mouth, right? Then get a face towel, right? Now that I'm done with the oral care, use face towel to clean the patient's mouth, and I remove the used towel, discard. Then I give lip care to this patient, right? I give lip care, then I continue. Now it's time for me to apply cream on this patient. I apply the cream, I rub, and I apply, and I rub on the face of the patient. So I apply cream, I lubricate the skin by applying Vaseline jelly so that the skin will not crack, right? After applying it from the hair, from the face, the chest, up to the feet, I allow my patient also to lie down, right? I also apply it to the patient's feet. I apply. After applying, then also the next thing is for me now to take care of the pressure areas, right? Like this is a female patient, I have to apply powder right under the breast. So it's optional, it's either jelly or powder. So I apply powder under the breast, right? I also apply powder, talcum powder on the elbow. So you concentrate all around the pressure areas. That's the elbow beneath the breast. I ask my assistant also to lift the patient for me. That's behind the scapula. Also apply powder here in a circular form to aid circulation. Apply it this way to aid circulation, right? This way. You can also do it around the hip, apply around the hip, right? Also apply it this way, isn't it? So assist the patient to lie down. So after taking care of the pressure areas, now it is time for me to put a new clothing. So my patient's new set of clothing is here. Then I ask my assistant to support me to put on the new set of clothes for my patient. So I ask my assistant to help me lift this patient and carefully remove the Macintosh and ask my assistant to help me put and I button the clothes, making sure that my patient is properly dressed. So, and before I put the pants to my patient, I allow the patient to lie down, right? So me and my assistant will also try to remove the soaked Macintosh and discard it inside laundry bag, right? And then put on my patient's back her trousers. And then remove the bath towel and also discard it inside the laundry bag, right? Make my patient comfortable. As you can see, this patient is neatly dressed. Together with my assistant, we try to make the bed, straighten the sheet so that it will not cause more, expose the patient to pressure source. Try to make the bed neatly, arrange the bottom sheet. Together with my assistant, we put back the top sheets, right? Always remember not to cover your patient's face. You spread it evenly and put the blanket also. Yes, remember that. Together with my assistant, we tuck in the foot end of the bed. Remember, these top sheets, they are clean. That is why we are replacing them. We also try to make an envelope corner to make the bed this way neatly, right? Together with my assistant, we ask the patient, do you want me to cover you completely or do you want me to leave it half? So the patient said I should leave it halfway. She don't want me to cover her completely. So together with my assistant, we make it let the sheet look neat. I ask my assistant to tuck in her side and I will leave my own side so that the patient, if the patient wants to adjust or move, can have easy movements, right? Inside, maybe you want to change position, right? So we have come to the end of this procedure. I hope this procedure is helpful and I hope that you've learned something or you have built upon the previous knowledge that you are having, right? So after finishing this, do not go away. Let's continue. We have to discard what? Use equipment, of course, right? So since it is OSCE, right, you tell your examiner that you discard used equipment by rearranging them because there is next candidate that is coming, right? So you rearrange them. So I'm discarding by rearranging my equipment, right? So because this is what? OSCE, right? So I'm done rearranging this equipment. The next thing is for me to what? remove my glove. Together with my assistant, we remove our gloves, and then we go and perform hand hygiene, right? So you remove your glove this way. Remember to avoid contaminating yourself. Discard it in the bin, discard it inside receiver for use, glove, or inside the bin, right? So follow me, let's go and perform hand hygiene. I'm done doing this procedure, right? So it is left for you now to carry the patient's folder. If it is on computer, you input all the information. Number one thing that you are going to input, the time that you birthed this patient. Secondly, what are those things that you observe while birthing these patients? Are there rashes on the skin? Is the patient trying to develop, has the patient developed pressure sores, or are there areas on the patient's body that is trying to develop pressure sores? These are the things that you pen down, you document, right? And also you should also document that you have given pressure area treatments to this patient. You have performed oral hygiene to this patient. All this you document. Remember, in nursing, any procedure that you do not document, you haven't carried out the procedure. So documentation is very important, right? So thank you for staying with me. Thank you for watching this video till the end. I still remain Nurse Clement B. Do not forget to like, share, and subscribe to my YouTube channel. Thank you. Bye bye.